Well, good afternoon, folks. Welcome to the Labor, Health, and Social Services Committee, Senate. Pleasure to have you here. We've got a nice group in the room. And we have folks joining online. I think I have half a dozen folks that want to comment from online. So we have two bills before us. We're going to do them in the order I think that they were on the announcement. Senate File 74, which is immunity and drug overdose reporting, which is our last committee bill from the interim. And then we'll go to Senator Crumb's bill, who's a member of this committee, on the certificate of need repeal. So that's the order of business we'll go with. I didn't make any arrangements. I will say, since there's a lot of folks here, probably for both bills, I'm assuming that. I think if we have some kind of central spokespersons that want to kind of speak, and then if something gets missed, then other folks come forth and add in or fill in anything that might have been missed, just so we can get through it. We have until, we have an hour and a half, basically, for both bills. So we'll try to move through them in a steady but expedient way and get all the information so the committee can consider it. The committee knows that you're here to inform us, and we'll take that information and hopefully make good policy decisions and advance the bill if we feel the bill is addressing something that you've convinced us of, or maybe not advance the bill. So we appreciate you being here, and we're going to start right now. Is there anything from the committee? Anything from my committee? All right. Clayton, do we need, all of our members are here, if you'll note that for the roll. Do you have anything for us, Clayton, before we get started? All right, thank you very much. All right, first bill for our consideration is Senate File 74, immunity for drug overdose reporting. As I mentioned, this was a bill that was brought to us for interim topic, and it was worked by the committee, and the bill before you was the work of our committee work from the interim. There's two of us, as I've mentioned before, that are holdovers from the interim. So maybe we'll start, would anybody like to actually present this bill in its broadest form? And then go ahead, Ms. Somerville, thank you. And then we'll go to those that might have interest in it one way or the other. Ms. Somerville, welcome, thank you. And you have a guest? Just go ahead and, go ahead and introduce yourselves. And actually, that's a good idea. When we get kind of into the flow of testimony, there's two or three of you that you think you're going to have different comments. Go ahead and fill the chairs, and we'll just keep rolling so we don't have his time in this transition. So, Ms. Somerville, please.
Thank you, Mr. Chairman. Andy Somerville, Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers. Committee, thank you for having me here, and I'll let my colleague just introduce herself.
Hi there, Mr. Chair and members of the committee. My name is Dr. Angela Farron, and I am the President and Chair of the Wyoming Naloxone Project.
You kind of trailed off right at the end. What, you're the president and chair of?
Oh, the Wyoming Naloxone Project.
Naloxone Project,
Yeah.
Thank you. Please proceed.
Mr. Chairman, as you stated, this was a bill that was brought through the interim, and I'll just go through it kind of real quick, page by page. The general purpose of the bill is to create immunity for two particular criminal offenses if somebody calls 911 to get medical assistance for somebody that is overdosing. And we'll go through, there's some specific requirements here. So start on page 2. Starts on line 1 with a person who in good faith seeks medical assistance for another person. They have to reasonably believe that somebody is experiencing a drug overdose. They have to fully cooperate, as it goes through this page, cooperate with 911, provide a location, a description. They have to tell law enforcement what happened. They have to fully cooperate with law enforcement, answer their questions, cooperate with the hospital, EMT personnel. This page really spells out that it requires full transparency from the person that called 911. If they do all of those pieces, then as you go to the next page, page 3, looks going down to line 16, line 13, immunity from prosecution for the person that placed the call to 911 and obtained assistance. They would be immune from the possession of a controlled substance or the use of a controlled substance, so under the influence of a controlled substance, essentially. There are limitations on the next page. On page 4, starting on line 1, that this immunity cannot be used more than 2 times in a 12-month period. The page 4 follows going through all the definitions. Page 5 at the top, line 2 specifically says that it would prohibit the criminal prosecution of a person for an offense due to the bill. And then it goes through the rest of the bill to define that it does not provide immunity for any other crimes or issues. And the bill really does underline that they have to fully cooperate with law enforcement. So if they lie to the officer in question, then they're not going to be eligible for immunity under this act. Pages 6 and 7 specify the statutory provisions under which the immunity is valid for those two crimes. Mr. Chairman, that's the bill, so before I provide any other information, I'll stop and see if there's any questions on the actual draft of the bill.
Thank you. Any questions on the actual content of the bill, intent of the bill from our committee members? Yes, Senator Steinmetz, please.
Thank you, Mr. Chairman. I was just wondering if you could help me understand, and I'm new to this committee, so I apologize, just help me on along here. So on page 4, it says the section, it can't apply more than 2 times in a 12-month period. And then it goes on to say the limitations under this section shall not apply to a person who seeks medical assistance for himself or another person. So how does that work? Is that kind of a loophole to where the 2 times in 12 months doesn't apply at all?
Go ahead, Ms. Somerville, if you would, if you know, and if you don't know, we'll look back at it, because actually now that it's pointed out to me, I'm actually questioning it myself. But
Yeah,
go ahead, Ms. Somerville.
Mr. Chairman, Senator Steinmetz, I'm rereading that sentence. Senator not apply to the person who seeks medical assistance for himself or another person within subsection A. Mr. Chairman, I would have to defer to some legal interpretation. The piece in there that it does not apply to the person seeking medical assistance for himself. So if you're calling 911 for yourself, this bill does not apply. But the other piece of that, I'm not entirely sure if that just refers to some type of other medical assistance outside of a drug overdose event. I apologize, Senator, I have to get some legal clarification on that.
Thank you, no worries. Further questions maybe from Ms. Somerville? All right. Go ahead, Senator Hutchings.
Thank you, Mr. Chairman. I appreciate that. Mrs. Somerville, how often do we see this happening around the state where someone calls in and they're being prosecuted for this very offense?
Ms. Somerville.
Mr. Chairman, Senator Hutchings, my apologies, our law enforcement partners had to run downstairs for another House committee meeting, so unfortunately, he would probably have better information. I would defer to my colleague if she has any specific information.
Yeah,
Go
Mr.
ahead.
Chair,
Go ahead,
Senator Hutchins.
Doctor.
Absolutely. So I will say that from a Laramie County perspective, we do review all of our fatal overdoses, and there have been several occasions in which law enforcement either wasn't called or it was a delay in calling during an overdose because of that fear of legal ramifications. So I would say that from a county perspective, certainly we do see that the absence of this legislation does affect if people are calling 911 in this type of medical emergency.
Follow up, go ahead, please.
Thank you, Mr. Chairman. And ma'am, when you say several, can you throw out a number? And I'll ask the next question so you can go over that too. Are we finding that there are specific places where this is happening, UW, the community colleges, more than any other place as well?
Please proceed.
Yeah, Chairman Barlow, Senator Hutchings, thank you for that question. I will say that I can absolutely get you that specific number from our reports. We do have some targeted areas within our communities, and more often than not, I can't really speak to Albany County because I work primarily in Laramie County, but there are some areas that are more highly populated for overdose. We do see some sometimes at motels here in town. We also see some just around the downtown area. So those are really the areas in which we see more concentration of overdose.
Thank you. Another?
Yes, thank you, Mr. Chairman. And again, I'm going to want if you can throw out a number on the several. And then what is the difference between this law and our Good Samaritan laws?
Please proceed.
Thank you.
Yeah, Chairman and Senator Hutchings, thank you. I'm happy to get you those numbers. I don't have them with me
Okay.
right now, but the difference between this and our Good Samaritan law is our Good Samaritan law that is established now really covers if somebody were to give an emergency medication that would cover them from liability. So if you were to give like epinephrine or CPR or even naloxone and the person might hit their head, that really covers them from the liability of an injury associated with that. This is specifically if a person is calling, if they're using any type of illicit drugs or maybe misusing a prescription drug, that if that is present, then they would have immunity from law enforcement or any type of legal proceedings.
Thank you. Further questions for me?
course.
Senator Crum.
Yes, Mr. Chairman, just a question on page 6. With all the exceptions there, just want to make sure that somebody that's distributing illegal drugs would still be prosecuted for that.
Go ahead, Ms. Somerville, if you'd like to, but I can answer it as well.
Mr. Chairman.
Because of the language in this, those folks are still subject to prosecution. It's because of that first language, that new language, except as provided under this new potential provision, they are subject to it.
Thank you, Mr. Chairman, that's the way I read it, I just wanted to confirm. Thank you.
All right, thank you. Anything further? No.
Mr. Chairman, Senator Crum, that is correct. WAMSAC stands here today in support of the bill, primarily because we are seeing this across all 23 counties. We have reports from our law enforcement partners that they are seeing, in particular fentanyl, has come out, and they are responding to a number of calls, sometimes too late, or we're getting a lot of those anecdotal stories about, well, we should have called, or nobody wanted to get in trouble. We are the last state that does not have this type of overdose reporting protection to try to encourage people to step up and make that 911 call and get the person that they're with, the friend, the family member, whoever it is, assistance. And we certainly want to encourage them to do that because it helps us get them on the road to treatment as well. When somebody's brought in and has contact with medical personnel, sometimes it may be the first intervention opportunity that they've had. And so we can start to address some of those issues and hopefully give them some options and put them on a path to recovery. So this is just, again, one piece in that wheel, and we are seeing that across all 23 counties.
Thank you, Ms. Somerville. I just want to confirm, I want to confirm I understood it correctly. We are the last state that does not have some kind of an immunity for reporting an overdose. Is that accurate?
Mr. Chairman, that is correct.
Okay, thank you. All right, anything else for us, ladies?
Ooh, just one more.
Yep, Senator Hutchings.
Thank you, Mr. Chairman. I noticed on page 4, line 14, and this, I was searching for this because the young lady brought this up, that it's not only controlled substances, but just a drug and overdose, period. Is that correct?
Go ahead, please. Whoever would like to respond, go ahead, please.
Chairman Barlow, Senator Hutchings, that is correct. We see overdoses, even though, even at the county level, our overdoses are about 70% opioid involved, 30% of those are still other drugs, which can be stimulants, methamphetamines, or just overconsumption of either over-the-counter or other prescription drugs. So this is not just opioid specific, but it is blanketed for all drug overdose events.
Thank you, and I think the way I read that line 14, there is a substance combined with a controlled substance, so it's a combination, the way that reads.
Just seems kind of
Although it's,
odd.
I could understand where it's a little confusing in that, but, all right. Senator Scott.
Mr. Chairman, on that point, is the other substance often alcohol?
Go ahead, please proceed.
Yeah, Chairman Barlow, Senator Scott, we do see a lot of alcohol use disorder here as well. We primarily are talking mostly about illicit substances or misuse of other drugs, just because, alcohol is legal here in the state of Wyoming. So typically people will call in the event if there is some adverse effect with alcohol or overdose with alcohol, but it could certainly pertain to alcohol, especially for people who might be underage who are afraid of calling 911 if there is consumption.
So yes, maybe, I think is the answer.
Yeah.
All right. Further questions for these ladies? Thank you very much to both of you. Who else would like to kind of have an overview of the bill, for those in the audience, kind of have an overview of the bill? So we're glad to take some just general comment from the public, and we'll go, I don't think anybody online wants to, oh, actually, there's one online. Nope, actually, Andy is here, so she signed in online, and came here. So come on forward. Do you have more you want to offer? Go ahead, please,
I just do
Doctor.
have a little bit of additional testimony, if you
Go
wouldn't
ahead,
mind.
please.
Okay, so again, Committee Chairman Barlow, thank you so much. I'm just speaking on behalf of the Wyoming Naloxone Project. So just some education on this policy that again is implemented in all other 49 states in the US, which provides individuals immunity for reporting 911 in a drug overdose, specifically when there's paraphernalia in the setting. Wyoming is currently the only state, and we touched on that, without such law, and research suggests that implementing this could absolutely save lives. So the primary purpose of this bill is to encourage individuals to seek immediate medical help during an overdose event without fear of arrest or prosecution. Drug overdoses, can be life-threatening, and time is really of the essence of these situations. So by removing the threat of legal consequences, individuals are more likely to call for help when someone is in immediate danger, which significantly improves their chances of survival. The three-strike clause that we see in this bill is not really seen in other states, and that's just because it may indirectly discourage people from making that life-saving call. So giving people more safety in calling during an overdose especially is important now that we're seeing stronger drugs, like Andy mentioned, fentanyl, in our drug supply. Legislation like this can reduce barriers to seeking help for substance use treatment by promoting a more supportive and safe environment where individuals feel more protected. And these laws really do help reduce stigma often associated with drug use and overdose. This can create an atmosphere where individuals are more likely to reach out for help, whether in an emergency or just considering long-term recovery options, and is crucial in helping people access treatment and support when they need it. Studies have shown that legislation like this increases the likelihood of 911 calls and reduces the number of deaths from overdose. In states with these laws, emergency response times are improved, and more people receive timely medical treatment, including the life-saving intervention of naloxone, which can reverse these overdoses if there is an opioid involved. It's also important to recognize this law does not provide blanket immunity, like we talked about, for distribution. It's specifically targeted to encourage life-saving behavior in an emergency situation. It's a measured, health-focused approach that focuses on the priority of saving lives. In conclusion, Senate File 74 can help address the opioid and overdose crisis here in Wyoming by removing a barrier to seeking help, and I hope this information will assist you in considering the benefits of this legislation. Happy to stand for more questions if you have any.
Thank you, Mr. Chair. Dr. Angela, you said this so fast, the organization you're with, it was, can you say that slowly?
Yeah, absolutely, Chairman and Senator Hutchings. I am from the Wyoming Naloxone Project. Yeah, it's NALOXONE, Wyoming Naloxone Project. What our mission and goal is just to get naloxone into our communities to help with this drug overdose crisis.
That
Absolutely.
naloxone was put into law several years ago. I can't remember the year, probably 18 or 19, I think, is that timeline. We actually codified that. Probably Senator Baldwin was probably the chairman at that time. I wouldn't be surprised. So anyway. Anything else? All right, thank you very much.
Thank
All
you.
right, anybody that wants to testify on this bill, please come forward. There's three chairs, I think, and 3 mics, so let's not be shy. And we can do Rochambeau, rock, paper, scissors for who goes first, or I'll start on my left, your right, and you can go first. Ms. Parsons, it's great to see you. Please proceed.
I will keep mine very brief. I just wanted to communicate.
Would you go ahead and, I know who you are, but would you introduce yourself?
Yes, I got ahead of myself. Thank you, Chairman Barlow. I'm Rhea Parsons. I represent the Wyoming Association of Sheriffs and Chiefs of Police, and I am here to communicate that law enforcement stands in support of this bill. That's it.
All right, thank you very
Yep.
much. Ms. Parsons has done a lot of work throughout the years with prevention, et cetera. Used to be from my community, is now in Laramie County. We miss her. And I just point out, for the law enforcement, both of the 2 exceptions, the 131 and 139, are both misdemeanor provisions in law for both possession and under the influence. They're misdemeanors. So just to be clear, that goes to Senator Crumb's question earlier about other things. Will those get into felony realms and other statutes? So Senator Hutchings, do you have a question for Ms. Parsons?
Yes, sir, Mr. Chairman. Mr.
Ms. Parsons, I'd like to know what you think about line 1 on page 4, where it says, not more than 2 times in a year that they can commit this crime. How do you feel about that?
So probably, you don't have to, does WASCOP have a position on this?
Yes,
I'm not going to
how's
put you
that?
personally on the line.
Do you have a position on
Does WASCOP
that?
have any concern or thoughts on that? Thank you.
So, Senator Hutchings, I have been part of conversations around that. I think law enforcement feels comfortable with that number. Of course, accountability is always important for law enforcement specifically, of course, but recognizing that they may be in that situation more than once in a one-year period. So the conversations that I've been a part of is that that's a fair number. And law enforcement communicates with each other. So I think one of the questions came up was, what if that person, it happens in Campbell County and then happens over in Sheridan County? But I think there's communication, or it doesn't limit communication for officers to communicate with each other about that number.
Thank you. Senator Scott.
Mr. Chairman. It isn't going to work. Mr. Chairman, on that particular provision, am I reading that correctly, that that applies to the person who has the overdose, who didn't call because they were essentially unable to call probably? And that the real effect of that is if you get 3 of those offenses, frankly, the person is doing it so often that they're better off getting prosecuted and getting held someplace where they can't. Is that the reasoning behind that exception?
Go ahead, Ms. Parsons.
Chairman Barlow and Senator Scott, I do not have the bill in front of me. I guess I was thinking this was around the person doing the reporting, not the person suffering from the overdose. So am I?
So actually, it's both. And that particular section, just for the audience, it doesn't have the bill in front of them. A person experiencing a drug overdose event shall be only eligible for 2 times. So this is about the person, this particular section is about the one who is experiencing the overdose. So I think maybe Senator Scott's point is correct, that if you're the one that's actually experiencing it, it's 2 strikes and then they're going to have a different route, so.
So because I'm unsure about that part, I can't say definitively the position of WASCOP on that, but I'm assuming, I'm going to just, I guess, for myself, assume that what you're saying is correct as well.
And I would say, Mr. Chairman, because if you go back to page 2, or I guess I am the chairman, he was the chairman. My Senator Scott, on page 2, line 6, this, the person reasonably, he or another person. So if you are the reporting about another person, then this limit does not apply. If you are the one actually with the overdose, then the limitation, the way I read it, like I said, Mr. Chairman, he was my chairman, co-chairman, so this would apply. So I think that's a simple reading. Thank you. Anything further for Ms. Parsons? All right, thank you very much. Good to see you. Ms. Kamelski, and you've got a colleague here, a friend here, so go ahead and proceed. And if anybody else is going to testify that you think you're going to say something different than what's said here, come on up.
Good afternoon, Mr. Chair, members of the committee. My name is Sophia Gomelski. I'm the Director of Governmental and Community Affairs for the Associated Students of the University of Wyoming. And I'm here today representing the student body and asking for your favorable consideration for Senate File 74. I first just want to thank you, Mr. Chairman, for your help coordinating with us and making the legislative process accessible to students. That does not go unnoticed, and I appreciate all of you being here and taking the time to listen to us. I'm here today with the Student Media Editor-in-Chief, Ben Meester, as well as our Director of Student Outreach, Hayden McKenzie, 2 of our ASUW Senators, Jonathan Christensen and Edwin Morales, and a student at large, Jake Harps. And I think first, maybe I should start out by walking you through the memo that I provided. I do also have physical copies, but I believe some may have been put over there already.
All right, maybe show us what that document looks like. Okay, the AS.
Yes.
Okay, ASUW, all right.
Yeah.
And hopefully you can do this briefly, because we're not
Yes.
going to go through it line by line.
Nope.
Go ahead, please.
Starting off, pages 1 through 9 are just the resolution that ASUW passed in support of the bill. That's because the bill addresses a really critical issue, and as students, we're deeply invested in its outcome. As you may notice, Interfraternity Council and the College Panhellenic Council are noted as sponsors of this legislation, or of this resolution. I spent a lot of time speaking with dozens of students from our Greek life community, and they all feel very strongly in support of this legislation as far as personal responsibility goes and the importance of really making sure that we are a safe and responsible campus. We all strongly believe this legislation will encourage individuals to seek help during emergency situations without fear of legal repercussions. By providing protections for the people acting in good faith, we can save lives and reduce preventable harm and promote a stronger culture of care and safety in our communities. We also conducted a survey to better understand how students and community members felt about this particular legislation, as well as its implementation, like whether immunity should extend to the person experiencing the overdose. The survey was available for roughly a month, and it received over 100 responses, ranging from university alumni to law enforcement, but primarily from students. The survey report is on pages 10 through 16, and I've left the responses completely unedited, with the exception of removing the names and emails of respondents. I also just want to add a quick clarification that while the charts make it seem like there was no option to select no, not in favor of this legislation, that was in fact an option. It was just not selected by anybody. So 100% of our respondents said that they believe Wyoming should adopt this legislation, or they believe Wyoming should adopt this legislation and include certain underage alcohol offenses. Notably, I think just not to get through the entire survey, but 21% of people expressed that they have refrained from calling for help in an emergency drug or alcohol-related situation because of fear of legal repercussions. The survey then goes on to ask respondents if they'd be willing to share any kind of personal experience that they may have with the subject. I think that all of you will find this portion of the report to be the most moving piece of evidence as to why we need this law. As you already know, Wyoming is the last state in our country without any Good Samaritan fatal overdose protections. So the remaining portion of the memo from pages 17 to 24 are excerpts from the Legislative Analysis and Public Policy Association's report regarding the implementation of these laws and their variations across the country. With the exception of only 5 states, these laws across the country provide protections for both the overdose victim and the person calling for medical assistance. Only 6 states after that limit the number of times a person can receive protection. Nevertheless, the opioid epidemic continues to devastate communities across the United States, with drug overdoses representing the leading cause of preventable death in our country. According to the Wyoming Department of Health, there have been an estimated 472 deaths due to drug overdoses between 2018 and 2022 alone. This pervasive crisis has left no county in our state untouched. As such, I would just like to urge the committee to return the bill to its original draft without any limiting amendments that were ultimately passed during the June interim session. I think it's essential for these protections in this legislation to be as broad as possible so that they can remain effective in reducing overdose deaths as they've been proven to do. I urge you to vote yes on this critical piece of legislation because, Mr. Chair and members of the committee, the world really does need more cowboys. Thank you.
All right, thank you very much. Appreciate it. Any questions for Ms. Gomelski? None? Okay. We'll start over here. Okay, we'll start with black and we'll go to white. Black jacket, white shirt. Go ahead. Introduce yourself.
Beautiful. Thank you, Chair. My name is Ven Meester. I'm here today in my capacity as the editor-in-chief of the Branding Iron. That's our student media over there at the University of Wyoming. So I'm speaking as a representative of our public forum. I'm going to throw some numbers at you. I'm going to give you a couple quotes and kind of walk you through it here. So the survey that was discussed, 82% of those responses were students. Of those students, 100% responded yes to Good Samaritan fatal overdose prevention laws. In my years in politics, I have never once seen 100% yes on any survey ever, and I'm sure that all of you senators can concur on that. There wasn't a single holdout. Everybody, every single student we had was in support of this. And 88% of them said there should also be Good Samaritan laws for particular underage offenses. 100% of these students also supported protections for both the person who calls in the overdose and the person overdosing themselves. And as mentioned earlier, an entire fifth of our student responders have actively refrained from calling or seeking help due to a fear of legal consequences. The fact that a fifth of our student responders have even been in this situation, let alone forced to stand by in fear, is a serious failure in our system. Now I'm going to provide two quotes from our responses, obviously anonymous, the first of which a student originally from Colorado. I am from Colorado, where the Good Samaritan law applies. At a party in high school, a girl was drinking while being on certain medications and passed out and started seizing. The people who didn't know about the law yelled at everyone not to call the police and ran away from the scene. Luckily, an ambulance was called by someone aware and the girl was taken to the hospital. If the law wasn't a thing in Colorado, the girl would have died because of other people's fear of getting in trouble. The second quote being from a student in Wyoming. I went to a funeral for a 19-year-old because the people she was with when she OD'd didn't get her help. I didn't know the reasoning or even their names, but I think of her almost every day of my life. She deserved to receive help and still be alive, but she isn't. And if this law could save one person, then it's good enough for me. Because people make mistakes and they shouldn't be left to die because of them. Moving forward, just in the general opinion of the public forum, it is the duty of the laws of this state not only to represent the wants of its constituents, of which students are an important piece, but to represent the safety standards of our nation. Who are we as Wyomingites to claim that we value the safety and protection of our students and our citizens if we are the odd state out in regards to these Good Samaritan laws? We must strive to uphold the standards set for our nation and ensure that our laws are best representative for the people of our great state. We are Good Samaritans. Every person in this audience, every person sitting at my table, every senator sitting before me, every member of Wyoming, we are Good Samaritans. Every one of us striving for the protection of our youth and our people. We are one of the best states in terms of mandatory reporting, and yet let those who fall into the dark world of drugs die on our streets for fear of persecution under law for trying to help these individuals, forced to pass by them without calling anyone to assist them simply because the law prevents us. So as a journalist and a mouthpiece of the student body, it is my responsibility before you today to implore you to pass Good Samaritan fatal overdose prevention laws because the students want it, our state needs it, and this legislature has an obligation to serve its citizens in need. Thank you, Chair.
Thank you, Mr. Meester. Any questions for the branding iron? Yes, please, Senator Hutchings.
Lynn, I wanted to comment on.
Would you turn your microphone on, please?
Comment on the survey. I'm really glad to see that the majority of the respondents have found that they have never been in this situation, which is good. And then I wanted to comment and maybe get your response on the personal responsibility portion of her comments. I don't think there's any law that prevents you from reporting an overdose. It's your fear that's preventing you from reporting it. So that's important. There's no law. And so how can you speak to personal responsibility? If you're in a gathering and you guys are drinking and it's underage, you're taking drugs, number one, you are disobeying the law. And so what do you think about personal responsibility in that respect?
Senator Hutchings, so I know we like to get more information, but I think you can answer as much of that as you
Yeah.
choose to, because I
Totally.
think there's some limitations to how much you want to maybe share.
Thank you, Chair. Thank you, Speaker. As, of course, a mouthpiece of a public forum as well as an objective party, I would speak to the fact that students all across the nation, as I'm sure you were all students at one time, of course must learn to take personal responsibility. We are also, of course, being human, being students prone to mistakes. I would say that within the scope of the student body, the idea is that while we are all prone to making mistakes, people shouldn't necessarily be left to die due to those mistakes, nor should they face the fear of legal persecution. The point that fear itself is the main thing preventing reportings is not necessarily an inaccurate statement, but that fear was systematically created by a lack of laws that protect that reporting, being why this problem is more significant in Wyoming than other states within the status quo. Thank you, Speaker, and thank you, Chair.
Thank you very much. Any other questions? We got to keep moving, so if it's pertinent, please ask, and then we're going to ask people to keep it shorter as we go. Go ahead, Senator Crum.
Very quickly, I just noticed on the survey, there's an answer about, do you support adopting Good Samaritan fatal overdose laws? And the main answer came back, yes, and I would support Good Samaritan laws for certain underage drinking offenses. So Just real briefly, any thought where it says certain, what do you mean by certain?
Go ahead, Mr. Meester.
Thank you, Chair, and thank you, Senator. Certain offenses would, of course, need to be outlined in particularity. For the purposes of this, the survey was relatively vague as the legislation itself wasn't fully established yet. And now that it has been identified, particularly with illicit and controlled substances, those would be the things that this would apply to in specificity. Thank you, Chair, and thank you, Senator.
Thank you, Mr. Chairman.
Please, thank you. Go ahead, please. Introduce yourself and provide your testimony.
Thank you, Mr. Chair. My name is Hayden McKenzie. I'm a student at the University of Wyoming, and I am the Director of Student Outreach for ASUW, the student government at the University of Wyoming. The student government, as has been previously established the survey, which led to a lot of really interesting results. I want to hit on specifically the survey results talking about students who have been involved in overdose reports. It's important to note that roughly 30% of the student respondents have been involved personally in overdose reporting. Of those, over twice as many students chose not to report an overdose to emergency services due to fear of being persecuted themselves. That's an incredibly high amount, over double the students. Further, I want to talk about how the fact that this is a bill that has been supported unanimously across campus. We had respondents from students, faculty, staff, alumni, and law enforcement professionals all on the University of Wyoming campus. They all said they support this. And across the state, this has been supported by medical professionals, law enforcement professionals, EMTs, etc. And beyond that, I've had the opportunity to talk to experts across the country. Just this morning, I had a conversation with a social worker from Delaware who was a major advocate for passing this exact same bill in Delaware. She talked about the amazing benefits that they have had from this, including reduced deaths, increased overdose report rates, being able to actually create programs that help reduce overdose just based off the fact that they have more information about overdose. This bill has been supported unanimously. It is something that the students are crying out for. It's something that the citizens of the state are crying out for. And I truly, truly believe that we should pass this bill. Thank you, Mr. Chair.
Thank you, Hayden. Any questions for Hayden? None? All right, thank you. Go ahead. If there's anybody else who wants to testify to this bill, there's going to be 2 empty spots. Come on up, and then we're going to go online if nobody fills up those chairs. Go ahead, please. Introduce yourself.
Thank you, Chair. Thank you, members of the committee.
You're going to have to pull that mic closer to you and speak up both, please.
Is that better? I am a quiet speaker, that's my bad.
You're going to have to get over that right now. This room doesn't have great acoustics,
Yep.
and we want to hear what you have to say, so please.
Yes, well, again, thank you, Chair, and thank you, members of the committee, for your time today. My name is Jonathan Christensen, and I'm an engineering student at the University of Wyoming, in addition to being an ASUW senator. And I am here to speak in support of Bill 74. I am beyond thankful for your time on this matter. As you are all likely aware, Wyoming remains the only state in the union without protections for reporting overdoses. That is a telling accusation when drug abuse is only on the rise throughout the country. Our state is no exception, with a significant increase in overdoses in 2023 alone. 126 deaths from just a recorded 60 in 2017. And that is just what has been reported. I've heard arguments against this bill ranging from promoting substance use to protecting drug traffickers. Notions such as these are why these problems persist. With healthcare providers leaving the state, there are less and less opportunities to seek help for addiction. The intent of the bill is to provide protection for those reporting an overdose so they can save a life. It is not forcing a decision of law or life on someone, but finding a middle ground instead. Be it weed laced with fentanyl or a roofied drink, alcohol poisoning. Underage adults and older continue to encounter these situations, and fear of prosecution prevents them from taking action. There are individuals in my life who would have benefited greatly had those around them not feared seeking help. I recently almost lost one of my closest family members because their friends' fear of the government outweighed the will to call emergency services. I never even knew about this until the day after, when I received a single text message telling me how close this member of my family was to dying. One mistake, and thank God they learned from it. But one mistake should not warrant me reading the obituary of those I love. I refuse to lose a third member of my family to something we have well-documented prevention for. Humans are not infallible. We are not absent of mistake or failure. Drugs and alcohol are not leaving the world no matter how many laws we pass. All we can do is pick up the pieces and give someone a second chance at living. Mental illnesses such as addiction are not moral failures. Experimenting with substances and alcohol are not moral failures. And if you believe that, you are condemning the vast majority of humanity. I'm asking that each of you here support this bill and recognize the evidence from healthcare providers and law enforcement so we can save lives. Until you are personally affected by addiction, it is difficult to extend empathy to those suffering. But that is why I'm here, to give you a story of those from the people that you serve. Again, I thank you all for your consideration and time on this, and I urge your support in favor of this bill. Thank you.
Thank you, Mr. Christensen. I know it's difficult to get up here and tell a personal story that is so much a part of you. So thank you for doing that. Yeah, thank you very much. Any questions for Mr. Christensen? Are there anyone else in the room that would like to testify to this bill? Ms. Gomelski, if you want to wrap it up for, and I'll say something about these fine students who came over here to testify. So go ahead, Ms. Gomelski.
Thank you so much, Mr. Chairman, members of the committee. I just wanted to come back up and reiterate kind of the reason that we all came down here today, which is sort of to just set the record straight, if that makes sense. Students are in no way, and we as a student government in no way aim to promote illegal drug use or illegal alcohol consumption. That's not our intention at all. But throughout my conversations with dozens of students, it's become apparent that there is a fear, and that this fear is creating a culture that has become unsafe for students. And so to prioritize this responsibility, the personal responsibility that it takes for somebody to be willing to call for help and medical assistance when there's an emergency situation, instead of panicking and we know that young people are the most susceptible to, substance abuse and substance abuse problems. And they also have, poor decision-making skills at a younger age. We want those people to be able to feel confident that they can call for help if they need it, instead of allowing themselves or the people around them to suffer a cost that nobody, their families, would think is fair for what they did. Thank you so much for taking the time to listen to all of us.
Thank you very much. And our thanks to all of the students who came and some that didn't speak. I see you have some colleagues there. But thank you very much. Well done. We appreciate you very much. Mr. Caldwell, is there anybody online for this bill? I see Ms. Somerville in the audience, so she does not need to be called in.
I believe they're all here for the next bill, Mr. Chair.
Okay, perfect. And that tells you the next bill has a different set of interests in it. So last time, any further interest on the bill before us? Immunity, any further interest? Seeing none, close public comment. All right, committee, there's an interest in walking through the bill, we can, or we can take some general conversation, or we can just move the bill. I have a motion from Senator Scott on the bill. Any discussion on the bill or amendments? Yes. Senator Steinmetz?
Thank you, Mr. Chairman. I don't have an amendment, but I was hoping that you could clarify that language for me on the top of page 4. That seemed a little bit circular about line 2 through 5, about the limitations shall not apply to a person who seeks medical assistance for himself or the other person in accordance with subsection A. So is that the 2 times in 12 months, that limitation does not then apply, or how does that work?
So this is where we get into what a subsection, a section, and a subparagraph is. But I think what I would suggest is that if the person, the person experiencing the drug overdose, they only have 2 strikes and you're out in 12 months. I think what we can do with the second sentence is strike the himself or on line 4. If you strike that, then this limitation does not apply to someone who is seeking assistance for someone else. There would be no limitation to that, if that makes sense. So the person that themselves This person who is experiencing it shall have 2 times, but if you are reporting someone else needing help, if we strike himself or from that sentence, then I think it cleans it up. The first one is for themselves, the second one is for someone else. I just throw it out there. And I don't know that we need to make a motion here. We could take it to the floor and do a committee of the whole amendment to make sure we're getting it correct. But I do see, I sense that there is a little tension in that. So Senator Crum, and then I'll go to Senator Scott. Senator Crum.
And you just said it, Mr. Chairman, but I was going to make a motion to do just what you said, to strike himself. So I don't know if we do it here or on the floor.
We'll get a little more comment on it and see if we want to clarify that right here as a standing committee. Senator Scott, did you want to comment on it with your microphone?
Yeah, Mr. Chairman, I would urge us not to change the language here, because as written, what it does, if the person who is the victim of the overdose is capable of calling medical, this still gives him protection, even if it's multiple times. And I think that you don't want to discourage that person from calling. I think that what it does is it says somebody who is not the one that called, who's been the victim of the overdose, they're the 2 strikes and they're out. And frankly, I think that's better protection for them to be prosecuted. But I don't want to discourage somebody who's experiencing an overdose, might be by himself, from calling. So I don't think we want to change that.
Thank you. So I think for the time being, I mean, at least unless I hear a motion, we'll just leave it as is. We can continue to think about it. I think I did understand from the testimony that multiple states do not have this kind of limitation anyway. So somebody could make the case that we just strike this section because 1, it's confusing, and 2, maybe it's unnecessary. Senator Hutchings, did you have another part of the bill you wanted to discuss?
Well, Mr. Chair, it's part of this, and when you say other states don't have this, is it the whole of section Delta, or just this one little portion we talk about on line 2 on page 4, the limitation? Because I'm concerned, and I'm gonna throw it out here, an amendment to strike 2 on line 1, and because if we're talking about personal responsibility and it's something that the students advocate, and it seems like everybody else does, why are we giving them multiple chances to do the same thing within a 12-month period? It seems like with personal responsibility, you would get the point that, hey, I'm doing something that's gonna harm me, and we're allowing them to come back 2 times in a year, or in my eyes, and it's just me, I'd like to amend it to say 1 time instead of 2 within a 12-month period.
All right, so there's an amendment on page 4, line 1.
Correct.
Striking 2, inserting 1. Discussion on the amendment? Discussion? Senator Crum.
Take it or leave
Yes, Mr. Chairman, my thoughts on it are, you look at 2 times when I think we're talking about a calendar year here. We're really talking about two school years. We're talking about 1, then there's the summer off, and then there's another school year. I'd be in favor for 2. I'm certainly not in favor for 10. Keep committing, but for 2, I do see where a person could make 2 mistakes.
Speaking against the amendment. Further discussion on the amendment? Further discussion? All those in favor of the amendment? This strikes 2 and inserts 1. Please say aye. Aye. Those opposed, no?
No.
No, chair votes no. Amendment is defeated. Thank you very much. Further discussion on that portion or any part of the bill? Further amendments? Further amendments? We have a motion on the bill. No further discussion or amendments. Mr. Caldwell, if you will call the roll on Senate File 74.
This is a roll call vote for Senate File 74. Senator Crum?
Aye.
Senator Hutchings? Senator Scott?
Aye.
Senator Steinmetz?
Aye.
Chairman Barlow?
Aye.
Mr. Chairman, that is 4 aye and 1 no.
Thank you very much. So this bill will be considered on the floor when the majority floor leader takes it up. I'm not going to ask Senator Hutchings to carry it. But if somebody else would like to carry it, I'll be glad to. Senator Scott,
I could, or he could.
well,
Hopefully we're doing
we'll arm wrestle it over these two guys, so. I want to express my thanks again to our constituents from the University of Wyoming, the students who came over here, fellow senators, I heard that, there's fellow senators out there from student government. So thank you, well done, we appreciate you being here. I hope you'll always feel welcome here, come and express things that are important to you and to the students that you represent. So thank you very much for being here. Now, if you'd like to sit through the next one, this has to do with long-term care. It's a ways off in your future, but you're welcome to stay and go through the next bill with us. If you'd like to depart and go celebrate this first milestone in this legislative process for 2025, I certainly understand that as well. So thanks again for being here. All of you, appreciate you all being here. All right, take care. Senator Scott.
On this, Senator Crum will handle it, and I'll back him up.
Okay, Senator Crum will handle this bill on the floor. So to the students, if you want to have any additional information you want to send forward, send it to Senator Crum. Of course, is a senator representing all part of Albany County. So we're glad he is here to work for his constituents. All right, thank you very much. Yep, thank you for all of it. Well done. All right, ladies and gentlemen, we're going to go to our next bill. We have just under 40 minutes to complete this bill. This is not a bill of the interim. This is our first personal bill. And actually, all the bills I think we have before us, we have no more labor health bills, so we have personal bills. Senator Crum, I give you the option if you'd like to go to the out in the there to present. He says, I'm going, all right. Yep, that's great. And then if you'll introduce your bill, walk us through the bill, and then we'll get to public testimony. Just give me an idea in the room. I know we have an agency here. We'll certainly have the agency testify next. I see just one agency, Department of Health. Two, okay. And then who else would like to testify? Just by a show of hands. 1, 2, 3, 4, 5, maybe 6. That was kind of a weak I want to do it. And then I have 5 or 6 people online that have said they want to. So what we'll do, as soon as Senator Crum's done, we'll go to the department. Agency will do kind of the organizational folks, and then we'll go to any individual type of testimony. And then for the folks online, if something hasn't been said that you want to say, we'll certainly raise your hand and we'll get to you. But I'm sorry that our time gets short, but sometimes the majority floor leader, she's in charge of our time and we have to adjust within it. So we're going to do our best to hear everybody and work the bill as well. And we will hopefully finish this bill today. If for some reason we don't, we'll carry it over until Friday, but we'll just be working the bill on the Friday. We'll take all public testimony today. That'll be my preference. So Mr. Crum, please walk us through your bill.
Thank you, Mr. Chairman. Gary Crum from Laramie, Wyoming, Senate District 10. The purpose of this bill is to repeal the certificate in need in nursing homes. Basically, big picture, nursing homes right now operate with 85% occupancy. Basically, a community cannot add a significant number of beds. They are allowed to add every so often up to 10% in their community, but basically they can't add a large number of beds. And so what the current statute does, which is 35-2906, does is limit the amount of long-term care space in the community, which in fact, in a lot of ways, creates a monopoly and doesn't allow for competition. And competition in any industry allows for innovation, new ideas, continuous improvement in care, and upkeep of facilities. So this bill in general deletes a lot of section 35-2906. But the really basic thing it does, and then the rest of the language that gets cleaned up and deleted throughout the bill, is do away with 85% occupancy to do a new nursing home, which is in 35-906A of the statute. So it's a very simple bill. It's to create more long-term care in our community. I've had people throughout the state, including geriatric doctors, come and ask me to bring this bill forward. They can't get sufficient care for their elderly patients in the state. I had just a very recent conversation with a gentleman from my community who tried to get his father in the nursing home across the hill and had to take him to Salt Lake City for care because there was no room in the inn, but yet the reports show that they're operating at under 85% occupancy. So what this bill does is really protects our seniors, long-term care folks. I know there's some disagreement from some of the nursing home industry as far as the competition, and it may or may not hurt the nursing homes. But in reality, when I've looked at competition through the years, being a long-term banker, we used to always complain about a new bank coming to town, which is a highly regulated government industry. But at the end of the day, a new bank coming to town made us all better and provided better services for people in the community. And I really believe this certificate of need repeal will allow that. Wyoming is one of the very few states left that have a certificate for need repeal. This certificate of need for long-term care was repealed nationally decades ago. So again, we just heard about, we're one of the laggers with another bill, and Wyoming here in this case is one of the laggers again. Mr. Chairman, that's the overview of the bill.
Thank you very much. Questions for Senator Crum? Questions for Senator Crum? Senator Hutchings.
Thank you, Mr. Chairman. Senator Crum, I've seen this before. And
Let's, wait a minute. You've seen it once before. How many times have you seen this,
yeah,
Senator Scott?
So
Oh, just kidding. Go ahead, Senator Hutchins.
I'm a little concerned. I saw it at first and I'm like, this is something I've seen, and now it's like, yeah. Can you give us a little background on some of the opposition, or would you just rather let somebody else do that?
The opposition can speak for, Mr. Chairman.
Go ahead, Senator Crum.
The opposition, certainly can speak for themselves, but as I understand the opposition wanted, competition may hurt them and not allow them to have enough income to keep a nursing home open, and therefore that nursing home will close. I think that's the big the big complaint is competition will hurt existing care providers. My big beliefs, as I stated earlier, is I believe competition will make us all better, will make the existing nursing homes better too. This bill is certainly not there to put nursing homes out of business or long-term care. It's really to create more long-term care and more quality long-term care for the citizens in our state.
All right. Thank you very much. Anything else for the senator? Seeing none, you're welcome to come back up here. Now you're part of our committee. You've done your advocacy. You can do the work here. As director and can't remember if it's minister. I don't remember the right title for your colleague, but anyway, I know she got promoted, so I can't remember what it is now. Go ahead, Director.
Good
Director
afternoon.
Johansson, Department of Health. Go ahead.
Mr. Chairman, members of the committee, Stephen Johansson, Director for the Wyoming Department of Health, joined by Laura Hudspeth, who is our Administrator of the Office of Healthcare Licensing and Survey.
Thank you. I couldn't remember where you were.
We'll keep our comments brief. As you mentioned, just how we operationalize this and have for decades. The Office of Healthcare Licensing and Survey does enforce and manage the certificate of need provision that's currently in statute. Senator Crum did a good job explaining the law in and of itself, essentially a restriction on nursing home construction and nursing home expansion based on parameters the legislature has assigned with an 85% occupancy threshold within a 30-mile radius and a limitation on the bed expansion to 10% or I believe 2 beds, depending on the nursing home size. The way this works, Mr. Chairman, members of the committee, is if a nursing facility wants to expand, or if a nursing facility or a company wants to build a new nursing facility, they submit a request to the Department of Health, Office of Licensing and Survey, so that we can run the numbers, look at the occupancy within that geographic area, and determine if it's approved or not. Since 2009, approximately 15 years, the most recent 15 years, we have received 18 requests for new construction on nursing facilities. 11 of those were approved, 7 of them were denied based on the statutory parameters that Senator Crum mentioned. For expansion, so current nursing facilities proposing or applying to expand, we've received 2 requests. Both were approved, but only one initiated an expansion because their occupancy rate in that area was well over 85%. They were approved for an unlimited bed expansion. But of those 2, only one facility moved forward with an expansion. So just a few summary statistics for you, a little bit of history there. The Department of Health doesn't have a position on this bill. We discussed and presented at the June Labor Health Joint Interim Committee on some of the history around certificate of need laws in the country, where they came from, what the intent was. Happy to discuss that further if the chair of the committee wishes to. Other than that, Ms. Hudspeth and I are happy to stand for any questions.
Senator Crum, please proceed.
Yeah, Director or Mr. Chairman, my question is, when, to your knowledge, do you know when the national repeal was of certificate of need, and do you happen to know roughly the number of states that continue to have a certificate of need?
Please proceed when you're ready.
Thank you, Mr. Chairman. Senator Crum, I believe the federal certificate of need provision was repealed congressionally in 1987. I'll confirm it was 1987. So in the late 80s. I don't have the answer off the top of my head. We were just discussing that on the number of states that currently have certificate of need laws for nursing homes. We can get that number to you. I will mention it's a little bit variable because some states have certificate of need laws that don't only include nursing homes, but include other provider types. But we can certainly try to find that out and prepare that number.
Further questions for the director? Further questions? Director?
Thank you, Mr. Chairman. Director, in Goshen County, we're close to Scottsbluff, and we don't have enough room for our seniors, so they usually end up in Scottsbluff in Nebraska. Do you think that this repeal might help that in some way?
Mr. Chairman, Senator Steinmetz, it's a really good question. I couldn't predict whether this would help there. It would really be up to 2 things. One, a current facility in the area, if this repeal were there, choosing to expand. 2, the current occupancy rates in that area, which would fluctuate and would be a bit fluid over time. And maybe the third element, if I could add that you all discussed as a committee during the interim, is kind of more of the philosophical question at hand is, if this were repealed, what happens in the broader market? I think conceptually, folks that, and states that have repealed certificate of need laws are trying to encourage competition. In Wyoming specifically, it's a difficult question to answer, given some of the natural market barriers we have with the low population and just uncertainty on new market entrants and investment for healthcare facilities, given some of those barriers. So it's a tough question to answer, but I think conceptually it certainly could if there were interested parties in expanding or the facility itself were interested in expanding.
C actually includes hospitals in part of this 10% dynamic. The way I read it, says there's a 4 hospital main. This is the
Mr. Chairman, if I can defer to Ms. Hudspeth, I'd appreciate that.
Yeah, thank you, Mr. Chairman, members of the committee. We look at this in terms of hospitals for the hospital swing beds. which are long-term care beds within hospitals. So we look at the occupancy for the swing beds for long-term care in terms of the expansion of long-term care beds.
Thank you. And then the next one is F and G. Striking those has no impact, whether it's the foster care, beds in foster care homes or alternative elder care homes. These are both identified or have definitions in statute. We're not striking those definitions. They may be needed elsewhere. Or G, the facilities owned by the state. Obviously, we don't have this. The state doesn't matter anymore, but particularly F. Any concerns with that? Please proceed.
Mr. Chairman, no concerns if the committee and the legislature chose to move forward with this bill. We don't see any issues with those specific repealers.
And what those do is say they're not nursing care, just for the audience. What they say is those two type things are not considered nursing care facilities. So they're actually exempted already. But I just want to make sure the repealers, unless folks go look it up, they don't know what the repealers are. So I just want to be clear. Go ahead.
Mr.
Director.
Chairman, through the magic of technology, have an answer to Senator Crumb's question. It's a broad number on the number of states that have certificate of need laws currently. 35 states, according to NCSL, have some sort of certificate of need law, but I want to caution or caveat that statement that they can be very different and highly variable on which facilities they apply to. But in a broad sense, some sort of certificate of need on healthcare facilities appears to be in statutes in 35 states.
Okay, thank you very much. Not the detail you wanted, Senator Crum, but a number. All right, further questions for the Department of Health? Thank you very much for being here. All right, who's next? Let's go, Mr. Boley, Ms. Passano. If you're coming up, come on up. And then I had several more in the middle of the room. You folks will be on deck next. And then folks online, if you will consider, if you don't hear something out of the folks that are going to testify, please raise your hand. And when we get done with the folks in the room, we'll give you an opportunity. As I say, we've got about 25 minutes left, so we'll keep forging on. Former Representative Passano, it's good to see you, former chairman of this committee. Please proceed.
Thank you very much, Mr. Chairman. Committee, it's good to see you. I have come forward
Go
today.
ahead, even though I
Carolyn
recognize-
Passano, Wyoming Healthcare Association. I'm sorry.
That's okay.
I have come in this room today and had a different thought than when I came in. And that thought is we are a week or two too early for this committee. I went to CMS and HHS before coming here, and you can't get any information from them. The new administration has a blackout on them. And that means there's going to be change. And my guess is great change. And that will have impact on how we go forward in doing what is best for our state. We all know that we have the least population in the United States, and that means that we cannot do what other states can do. And one of them is that CMS has frightened us all, telling us that there is a workforce mandate coming, and I don't know any of us that can meet it. We will all be fined, and heavily fined, unless we can bring something back so that we have an exception for this state with a paucity of population. And then thinking about the blackout, I'm saying that we are so heavily full of mandates from the federal government that this little state can't get enough money to make it easy to go forward if you are running a nursing home, and I'm not sure that I could. I think it's a very heavy and hard position. And then to get individuals coming up through high school that want to make it a career, that's even more difficult. I think that we are a little ahead of ourselves today, not that we knew we were going to be, but because of the federal government. And one more thing about the federal government that just crosses my mind is that one of the reasons we can't get enough workforce is because they have shut down any foreign workers that are trained and that we used to be able to get. And as a matter of fact, Senator Crum, I believe that the last ones came from the Philippines and they were in Laramie. The last in the state that we were able, the federal government allowed us to have. I am not sure what we should do at this point, but I do think that we are making a decision today, if we do, that could be impactful to what maybe we should open up. I like competition. I'm not sure that we're ready for this very day. And I don't know what we ought to do about it, if we should put this off for a couple of weeks and see what happens in Washington, or if we should go to an interim committee. I can't answer that, and maybe you can't either, but maybe that's a request. And I would just like to say that the occupancy might be a little off. I have one nursing home that is only got one bed empty. I don't know why anyone would have to go to Salt Lake City. The last one I knew was a person that had Alzheimer's and was so violent, that person had to be sent away. They couldn't handle them. I just have no more testimony because I think it's too early to make a decision. Thank you.
Thank you, Ms. Passano. Questions for Ms. Passano? Senator Scott.
Chairman, on the occupancy, to what extent do your nursing homes significantly below the 85% occupancy? And is it all of them? Is it some of them? Is it none of them? And if there's a problem, what's causing it?
And Mr. Bowler, you can queue up for this. You don't have to queue up right now, but be
get the
thinking
same
about it.
question.
You're going to get the same question. So, Ms. Passano, if you know of the nursing homes you represent, where they are with relation to 85, and then any causation of that. Thank you.
It goes up and down the scale. And it depends on how rural you are, or how many nursing homes are in, for instance, Cheyenne, or how many are in Casper. It depends on where the nursing home is. And as I understand, the occupancy is going up because our percentage of elderly is going up. And it makes a difference on what has happened in community with keeping people at home. We have so much to consider that we really aren't considering at this very moment.
So, Ms. Passano, could you give us a range? And I'm not.
I have that person or that nursing home, which I will even tell you is Lander.
Is that 100% nearly?
It is minus, just one bed is unfilled.
And then the lowest?
Then we go all the way down the scale, depending on how fast one of the facilities is coming back from the COVID. Not everyone has come back totally, and that's to be considered too. And there is one that is under. The rest are all there or above.
Okay, thank you very much. I appreciate that. Further questions, Ms. Passano? We'll keep going. Mr. Boley, please introduce yourself, provide your testimony.
Mr. Chairman, committee members, Eric Bully with the Wyoming Hospital Association and Leading Age Wyoming. And in answer to your question, Senator Scott, I think last I heard, statewide average is somewhere between 60 and 70% occupancy rates. And I'll just let you know that it's been rough on the other side. We've been steamrolled, so I may as well expect to get beat up while we're over here today too.
No, we're not beating anybody up. We just want good information so we can make an informed decision. That's all we're asking for.
So I provided you a handout. It's not just a handout, it's a slide deck, but there are actually 37. I noticed discrepancy in that one. They don't consider Wyoming as a state that has certificate of need. So there are 36 identified. This is a study that was done by Washington State Leading Age just a year ago. And it shows there are 36, but you should add us in there. I think part of it has to do with the fact that the hospital CON was repealed 40 years ago. And you know, I actually brought this as an interim topic a couple of years ago in hopes that we could take a look at some of the restrictions that are contained within the existing certificate of need. I've had some great conversations with Senator Crum over the last couple of years. And what I would say is that healthcare cannot really be considered your typical economic market. Most healthcare services are ordered for patients by their physicians, and patients really don't do a good job of shopping services. And you're gonna see a transparency bill on its way over from the House, I believe, and it's another great example of a federal mandate for us to have transparency, but the consumers aren't using it. It's there for other people. Without some mechanism to control growth in nursing home beds, public policy consequences are likely to include a two-tiered system, and this is what I'm really concerned about. One for private pay and Medicare, which is where our nursing homes make their money, and then another one for Medicaid. And in a lot of our nonprofit facilities in particular, they're 70 to 80% Medicaid, with a few private pay. I think what we'll probably see too, and this is through studies, is a gradual erosion of the quality of care in the older nursing homes as more and more of the money is siphoned off to these new facilities that are gonna come in for the higher paying. And what we'll end up with is some rundown nursing homes that are barely surviving. And obviously financial challenges for the highly respected nonprofits and the small for-profit community nursing homes that do not have the resources to renovate or replace older buildings. The other thing I'm really concerned about is the implication this has for swing bed. And one of the repealers that we didn't mention is in 352901A V or 5. And this basically, there's a provision in here to protect our critical access hospitals that rely on swing beds, which is skilled nursing. We have 19, we will have 19 when Sublet comes online, 19 critical access hospitals. Some of them only survive by having swing bed, which is skilled nursing care. And so I think of your community, Senator Steinmetz, in Torrington. I could see where if we open this up, where Scottsbluff could come in and put in a skilled rehab center, siphon off those swing bed patients, and could really severely damage your critical access hospital. And it could happen in a lot of our small communities. I think the last thing I would say, I ain't spent a lot of time, and I did last year on this, but if the problem was quality, let's address the problem. And I think we can actually accomplish that by utilizing certificate of need as well as utilizing reimbursement. We still are under reimbursed. Our Medicaid rates still don't come close to covering the cost of care. And when you consider that 60-70% our residents are Medicaid patients, it's hard for our nursing homes to survive. So, and I've suggested this, and I don't know where we'll go, but I really wanted this to be a good interim topic a couple of years ago. And what happened is it was easier to just repeal this, and we never really even looked into what's contained within the certificate of need. But I'm committed, my members are committed to bringing together a group, and let's look at this in the interim and see if we can use certificate of need to improve quality of care. We already have people that have invested in our state. We already have high-quality nursing homes in our state that could be damaged by a quick repeal. And it's obvious to me that repealing this is going to be simple. It would be something that can easily be done in both chambers. But we don't see people knocking the doors down right now to build new nursing homes. As you heard from the Department of Health, there have been very few over the last almost 20 years. We could take a year and really use this time to come up with a way to drive quality. And I believe that's what the residents deserve. And I think that's really what stemmed this look at this, at the certificate of need repeal. This bill provides a look back in 2029, I believe, to see what damage has been done by the repeal. I'd rather take time and see what we can do using the certificate of need to improve quality. We can always repeal it, but why not use it as the tool it could be? And I agree with some of the provisions in here. The 85% occupancy may not be right. I've got issues with the ability to create new beds and 10% of your licensed beds up to 10. So our nursing homes that have 20 beds could only do 2 every 2 years. When you take a look at some of the newer models of long-term care, the greenhouse, they build in pods of 12. And so if they wanted to build a new pod, it could take them potentially 5, 6, 7 years to build all 12. It doesn't make sense. And so I think there's some things we could look at that are contained in here, and that's part of the reason I wanted this looked at. We missed out on some great opportunities during COVID with ARPA funding and with CARES funding, where our nursing homes really could have utilized that money to expand their footprints and to improve their facilities, but because of some of the restrictions and certificate of need, they didn't move forward with that. And so I guess my ask, and I know I've got several of my members that are ready to testify online, and they can share some experiences. Some of them operate across state lines and have seen moratoriums lifted to allow new building to go on. But I think Utah would be a great example, and you'll hear from Rocky Mountain Care in Evanston. But I would ask that we take a measured approach and see if we can improve quality by using this as a tool that it could be, and also take a look at our reimbursement rates. With that, I'd answer any questions, and I appreciate your time.
Thank you. Questions for Mr. Boley? Questions? Go ahead, Senator Crum.
Not really a question, but a statement. I just want to say thank you to Mr. Boley for all the information he provided during this process. So thank you.
You bet.
Thank you, Senator Crum. Senator?
Mr. Chairman, clarification on the vacancy rates. Are your members seeing significant vacancies, and if so, where and what's the cause?
Go ahead, Mr. Boley.
Mr. Chairman, Senator Scott, yes, and it is, occupancy rates are starting to climb a little bit, but we're seeing a significant decrease since the pandemic, which is really detrimental, and it's because of staffing mainly. And one of the things that I didn't mention in here is as we bring new facilities online, we're going to be competing for the same staff. There isn't enough staff now, and so what you're going to do, and I think we've seen this is a great example of this, and I always use this one, but in Buffalo, where the VA was built a nursing home, our beautiful nursing home in Buffalo that was constructed at the hospital there has 45 beds. They've had one entire wing closed. They're down to 60% occupancy because they can't get enough staff. It's not because the demand's not out there. And they're competing for that. I'm actually glad to hear that things are different in Lander, but there's been a war on wages there between the state-run facility and the private facilities. And that's what I think we'll see happening is we're gonna be competing for the same staff. I don't really see an improvement in quality. I think what we might do is fragment it to the point where we have unsustainable facilities.
Okay, thank you very much. And I'm sorry, Senator Hutchings.
Thank you, Mr. Chairman. Mr. Boley, again, I've heard this before, and I wanted to know, let's say we create a new facility, because I'm for open markets and a competition, all that good stuff. But if we create a new facility in an area where there's already a facility, and let's say all the employees go running over to the new facility, can some of those patients move too? That's just something that came to my head. But then again, if the patients move, you have a hospital sitting there empty. What really happens in that scenario when they have the eye candy, something new, maybe more pay, but you're gonna leave patients without support?
Requires some speculation, but if you'd like to,
Yes,
if you'd like
it
to
does.
comment, you're welcome to.
Well,
Mr. Bowley?
thank you, Chairman Barlow and Senator Hutchins. That's a huge concern, and I mean, with the current workforce, we're seeing people leave for 25 cents or 5 cents and jump to new jobs without any plan. And yeah, I think what we may see is an out-migration of workforce. And yes, the residents are allowed to be discharged and move where they want to. So it would give them options, but I think what we're going to find is there's just not enough critical mass to support all of this, and so we'll see closures. And I can use, I'll use another example, in the healthcare, in the hospital industry. So in Casper, we had 2 physician-owned hospitals that were built up there. There's no certificate of need in place. Currently, both of those physician-owned hospitals came in, they took the highly insured, made a lot of money, had investors that speculated and invested in those. Both of those hospitals that were opened, and one of them damaged Wyoming Medical Center greatly because they lost their sole community provider status, which is $14 million a year. Wyoming Medical Center now owns one of those hospitals because it sat vacant, and they bought that one. It's their East Campus, and the other one was just purchased by one of our other hospitals in the state. And so that's what I think will happen, is we might see entrance into the market that can really hurt existing long-standing investments in our communities, where over time we'll see where they're either shuttered or they revert back to the old owners.
All right, thank you very much. I think we'll keep going unless there's something very burning. Mr. Lindholm, please introduce yourself.
Thank you, Mr. Chairman, members of the committee. My name is Tyler Lindholm. I'm the State Director for Americans for Prosperity here in the state of Wyoming, and I'll be very brief. The handout that you've got that's in the binder is from my organization, and it cites several very telling pieces of information, such as Medicare and Medicaid spending per nursing home enrollee is higher in certificate of need states. Now, correlation is not always causation, but things do start to stack up, such as the number of registered nurses in nursing homes is lower in certificate of need states versus certificate of need free states. Total Medicare costs are higher in states that have certificate of need requirements for nursing homes and home health agencies than in states that have repealed the law. Also, Mr. Chairman, members of the committee, we recently heard that there is a new administration that is coming into place, and we don't know exactly what that could look like, except for, Mr. Chairman and members of the committee, President Donald Trump and his prior administration did ask for the repeal of certificate of need. In fact, the last 7 presidents of the United States have all said, repeal your certificate of need. It is an outdated law that did not meet its intended purpose, which was to increase access to care. What we have found, Mr. Chairman and members of the committee, is that competition creates better alternatives, and competition also drives more accessibility to care. And also, Mr. Chairman, members of the committee, I certainly respect the worry that nurses are going to be picked off and going to other committees. Mr. Chairman, members of the committee, my wife is a registered nurse and a nurse practitioner. It wouldn't hurt my feelings a whole lot if she was offered more pay. So with that, I'll stand for any questions.
So, thank you, Mr. Lindholm. Any questions? My only one observation is Senator Scott has been here longer than those 7 presidents. So, you don't got anything on us here. Okay, thank you very much. Senator Hutchins.
Thank you, Mr. Chairman. Mr. Lindholm, how do you feel about the true concerns that if we start building more healthcare facilities, we're actually hurting the others at the cost of the free market?
Go ahead.
Thank you, Mr. Chairman, members of the committee. It's hard to say specifically what could happen exactly in our state. I'm not going to say Wyoming's the exact same as other states that have repealed. We haven't seen that borne out in those other states. Instead, what we've seen is greater access to care, ultimately is a beneficial thing, particularly for these little border areas, such as my community where I hail from. And even down here, we have a lot of residents that go across the state line because there's more access to care available in those areas. I would prefer, Mr. Chairman, I guess maybe this makes me biased, I would prefer if I end up in a nursing home that I stay close to Sundance and don't end up in South Dakota.
Thank you, Mr. Lindholm. Any other questions? Thank you very much. Thank you. Very much. We'll go with the gentleman in the center, and please introduce yourself for the committee. We're going to keep moving right along, so if you have something new, please present to us.
Mr. Chair, members of the committee, my name is Dennis Cook. I'm appearing as a concerned citizen, but I'm a lifelong resident of Laramie, an attorney who's practiced in elder law and estate planning, and I've been on our hospital board of trustees, hospital board of directors, and now I'm recently elected back on the hospital district board of trustees. So I have some familiarity with at least the nursing home issues in Laramie. And I'd like to just take some credit for Senator Crum on this bill, because this bill actually originated 3 or 4 years ago in the Board of Directors subcommittee meeting at the Ivinson Hospital, where Gary, or Senator Crum, Brad Jackson, Joe Steiner from the former head of the health department at the health school at the university, and myself were confronting how would we improve elder care in Laramie, Wyoming. And so, I'm sorry, as a lawyer, I should have known about this certificate of need statute in more detail before, but I didn't until then. And that's when we found out that there was no chance on earth that we could do anything about this in Laramie as long as the current facility was less than 85% full, which it has stayed under 85% full for a long, long time. So to do that, the only way forward was to come forward with a proposal to remove this certificate of need statute. Just no one or other avenue in that case. In Laramie, since I've been there, well, almost all of my 75 years, I think the last significant construction change at the current place was in the early 60s. And so it's operated with whatever, no need to change itself or improve itself. And so it's just unfortunate that this current certificate of need statute really, I think maybe it had an idea to protect institutions so they could improve and not worry about competition. But what it's actually done is stifled any incentive to improve your facility. And I'm not faulting the operators there. It's a for-profit operation. They have a corporate responsibility. And so if their choice is, well, the trade-off is we'll keep our occupancy below 85% in return for the trade-off of no one's going to get in our way here, I think that's been a fair choice that they've made. But I've started 2 successful businesses in my life in Laramie, and I didn't have any state government telling me that I couldn't do practice law because there were 10 other lawyers in Laramie. I couldn't open an investment business because there were a couple of stockbrokers in Laramie. There is no other similar state government restriction on an operation of a business. This is it. In the hospital, I've been on that, like, I figured 15 or 18 years of the last 20 or 25. We probably spent $100 million in Ivinson Memorial Hospital on facilities improvement, expansion, new equipment, new lines of service. And it's because of competition. We have to stay competitive. People in Laramie have the alternative to go south to Fort Collins, Loveland, Denver, or even over here to Cheyenne. And I guess I don't care about that happening, but we also have a charter in Laramie to provide health care so people don't have to leave town to receive their health care. Cancer treatments always required people to go out of town every day to get their chemo or their radiation therapy. So we changed that so they can get all that service in Laramie without traveling. So competition is a good thing. Free enterprise, capitalism works all the time. Gary told me maybe I shouldn't say this, but I will tell you that I'm a lifelong Democrat, but I am also a lifelong capitalist. And I believe that free enterprise is what makes businesses better. I think it works. And, you know, there's some stuff about hospitals have, for example, there's a list, Ivanson supposedly has a nursing home. Well, we don't. We got rid of our extended care facility and we went to swing beds, and now the hospital's so full that there are very few swing beds available. And all that has to do with reimbursement. But there is no path forward in places with for-profit nursing homes that aren't willing to improve. A lot of the list of nursing homes that Mr. Boley talks about, I think the oldest one of them was built or improved in early 2000s. I mean, we've been grandfathered in our facility since the 1960s. And the only way to improve this facility is to allow competition. And employees will move. And on to Senator Hutchings' point, though, patients will move too. I mean, that's the whole deal. I don't have, in my experience, not a single Laramie resident who's come to me for advice as they get older wants to go to the Laramie Healthcare or Laramie Nursing Home. And many of them make the choice to go somewhere else, even move out of town, up to Sheridan, Buffalo, places where there are better care facilities. So I think the only path forward is to take state government out of the business of deciding who can create a nursing home, and then the marketplace will work itself out. I do support the passage of Senate File 89.
Mr. Chairman, the question I've got relates, if this bill should pass and you get a new nursing home in Laramie, would it be taking the full spectrum of the population potentially, or would it restrict itself to primarily taking private pay patients who are not on the state Medicaid program? Is the Medicaid program reimbursing sufficiently to make a new nursing home pay?
Mr. Cook, please proceed.
Yeah, Mr. Chairman and Senator Scott, I think that's a good question. And so I can't say what a company that would want to create a new nursing home would want to do in Laramie, but there have been inquiries, and I don't represent these people, but inquiries from nonprofits that would like to do a nursing home. But it's my experience that it's really, if you replaced what's in Laramie, it'll have to be someone that'll take Medicaid and private pay. And then anytime you mention Medicare with long-term care, it's almost non-existent. Medicare only pays for 100 days at the most for a nursing home visit. So I think nursing homes, and even the ones that are not profit and nonprofits and everything, I don't think there's an experience that they'll only take off the cream in the crop. And then you come up with one other point. nursing homes struggle all the time with the Medicaid reimbursement rate. So that's an entirely different issue beyond this question. But I'd like to see us be able to build a ADA modern, compliant new facility in Laramie and let the chips fall where they may. And if the other outfit can meet and compete, that's a good thing in American society. The systems of government that didn't allow competition and took government into regulating what businesses could exist have failed miserably all the time. So I'm a free market capitalist, and
Follow up, and just slightly different version. Is there enough, you've dealt with people that are looking for a place to go to nursing home, as I understand. Is there enough of a market, in enough people in Laramie so that you could put in a nursing home that would take very few or no Medicaid patients?
Please proceed, Mr. Cook.
Mr. Chair, Senator Scott, I don't think so. And so you and I can speak actively on this, Senator Scott. We're not running out of old people.
This is true.
And my generation.
No, we're those of us who are older running from going to the nursing home.
And that's exactly right. So maybe some of my comments are self-serving, but no, there's no shortage, and the need is really there. And so my father spent his time at the end of his life in this nursing home, and he wasn't abused. But just think, any of you want to go into a 1950s era hospital the way they were designed, built, and operated, or would you like to go into one that stays up to date? And I don't think there's any way for us to do anything to make it an update facility without repealing the certificate of needs.
Thank you. Thank you. Well, I think we'll keep going. Go ahead and introduce yourself.
Thank you, Mr. Chairman,
Mr.
members
Cook,
of the...
we appreciate you. Go ahead.
Thank you, Mr. Chairman, members of the committee. My name is Chris Mickey. I'm with the Wyoming Business Alliance. I will be very brief. When the Wyoming Business Alliance and our members decide to take a position on a bill, one of the criteria we look at is, does that piece of legislation reduce regulation or barriers to entry for businesses in the state of Wyoming? And we do feel that this bill does that, and so that's why we are supportive of this bill. And while we appreciate the complexities and the nuance for the healthcare industry, we really do believe that it should be up to the free market to decide when and where a business should be able to come in and operate in the state of Wyoming. So that's all I have for you, Mr. Chairman. I'll be happy to take any questions.
Thank you very much. Please proceed. And folks online, if you want to say something you haven't heard before, if it's been said, I think we could probably not hear from you, but if you have something you want to provide, please raise your hand and you'll be coming up next. Go ahead, please.
Mr. Chair, members of the committee, my name is Jeff Darty, appearing today both on behalf of Cicero Action and also I'll make a couple of quick personal comments. Mr. Chairman, in deference to your comment, the previous Democrat capitalist actually covered a lot of my points. That fellow's welcome at my campfire anytime. But I do want to thank the sponsor of this, hitting dingers right out of the gates, and I appreciate it. This is an important bill. To distill this down to its simplest level, I would say this, in my mind, is equivalent to me wanting to open a Burger King and needing permission from McDonald's to do so. And to me, in support of the previous speaker's comment, that this bill brings an end to that. I did want to draw your attention to something that the previous speaker did not touch on, but between 2010 and 2020, Wyoming's 85-plus-year-old population has increased 13%, which is 6 times greater than the state's total population, and that's greater than the United States average. So there's a serious demand for this. Having been on a personal level, Mr. Chairman, through the end-of-life journey with both my parents recently, I can tell you that having options is vital. Dad was a handful, so we needed options there at the end. And the last point that I'll make for you is this, that having facilities, as Mr. Lindholm pointed out, close to the family is vital. Through college, I worked in the medical industry, and I can't tell you there's nothing sadder than folks who do not have access to their families because they're too far away. So right now, the last point I'll make to you, and then I'll take my seat, Mr. Chairman, is that to my knowledge, there are only 2 communities in the state that could build facilities, and that's not right. So, Mr. Chairman, the previous speaker nailed it. I think the private sector is far better equipped to solve this, and we need to let market forces run their course. So with that, I'll end my comments.
Mr. Chair, really quickly, Mr. Daugherty, are there people lined up waiting to build that you know of? Thank you.
Mr. Chairman,
proceed.
Senator Hutchings, I don't have the answer to that information. So I just don't.
Okay,
There may
thank
be
you.
others.
Thank you very much. All right, is anybody online, Mr. Caldwell, that has their hand up? Please admit. And I apologize to those folks online and the folks in the room. Like I said, we got some marching orders early, and I didn't, anyway, before we knew we were going to have this much testimony. So go ahead and introduce yourself, sir, and provide your testimony, if you can hear us.
Yeah, good afternoon. My name is Eric Connell. I'm the Chief Executive Officer at North Bighorn Hospital District in Lovell, Wyoming. I have been here for 4 years. I was born in Cheyenne. I love Wyoming. I love freedom. I've voted Republican my whole life. I love free enterprise. I don't like monopolies. All those are big, scary words. I would just caution the committee that it seems we're talking about some really specific instances around communities like Laramie where, hey, we may have some bad actors and some market entry would be really healthy. I would caution the committee to just say free market should rule the day and not consider some of the implications for our rural communities. My first point is this. Free enterprise doesn't work in our most rural communities. I work in a hospital district. We only exist because of the goodwill and faith that our community has in us providing healthcare services to the community. Think about that. We have people in a conservative state paying taxes so that we can have these services. We subsidize our nursing home so that we can, as a mission-oriented organization, provide care to our elders. I promise you, there was maybe some misconception about if we have entrance to the market. I guarantee you what will happen in Laramie. You will have a for-profit or even a not-for-profit, which the difference between not-for-profit and for-profit is one pays taxes, one doesn't. They still have a profit motive because they want to reinvest in capital if they're not-for-profit. They will come in, they will provide Medicare services for post-acute patients. So if the goal is we want custodial care for grandma who has dementia, you will not get that in Laramie. You'll get someone that comes in and says, those 100 Medicare days per year, we're going to use as many of those as we can after grandma's had a hip replacement. That's what you will get in the state. There is not a profit motive in custodial care. So even our for-profit operators in the state, if you ask them, they will tell you they're in the business because they need the post-acute Medicare revenue. That's the reality of the business. So I think you need to be very thoughtful about this. If they're bad actors, let's get rid of them. The second comment I want to make is that you will close down rural hospitals if they lose their swing bed programs due to competition. My mother was a nurse, OB nurse for her whole career. And I learned this when I wanted to get into healthcare administration. You need enough volume in order to have quality. So if you're in a small community delivering 150 babies a year, if there were a profit motive, which there is not, if someone comes into the community and you split that market, you're going to deliver 75 babies a year. You're going to add cost to the system. And absolutely, you will strip the vital services away from the mission-driven providers in these rural communities, and they will flee to the new shiny building, and that will be great. So I would urge the committee, please consider the consequences in the more rural communities. Do not repeal certificate of need and cause an issue for us. My organization, it will kill our swing bed program, and we will not be able to subsidize enough through our slightly positive operating margin on the hospital. We will not be able to support the nursing home. If somebody comes into the Bighorn Basin and says, you know what, we look at these 40,000 people, we've got 3-4 hospitals, we're going to plop down a post-acute, real nice building, will attract all the post-acute long-term care patients for those short stays, Medicare, and you will devastate us. So I think this is a bad idea. As much as I love free enterprise in the markets, and I don't like monopoly just as much as as you don't, but I would urge you to think about the other alternatives. If you've got bad actors in the state and you want new nursing homes in Laramie, great. Let's figure out a way to kick the bad actors out of here and attract some other operators. And I will also tell you, last point, and then I'll be quiet. There are, I know, nursing home operators interested in our state, people that would like to come in and make offers to those poorly managed, poorly performing, low quality nursing homes in the state. And if you repeal certificate of need, you will detract from those potential investments that would come into our state. What's more likely? Someone's going to come in, spend $8-10 million and build nursing homes in these states, or maybe we can attract some good actors into the state. So make it difficult for those that have poor quality. There's a lot of ways to do that. I don't think the committee has fully explored that. Make it hard on those. Teach those bad actors that this is not a state where we want to have bad quality. Otherwise, the state's going to make it difficult for us. They will lead the state. The good actors will come in, and you can improve quality. You make this a better place for healthcare in our state. So I urge you to be very thoughtful here. That's my testimony. And I would agree with everything that Eric Boley said.
Thank you very much. Questions? Senator Crum, quickly.
Just real quick, we heard earlier testimony that nursing homes through Medicaid, Medicare are losing money. And now we just heard testimony that a hospital will close if they don't get the Medicaid, Medicare patients. So I'm confused, and maybe this isn't the time to figure it out, but I'm confused. We got testimony from one that it's hurting, they're gonna, you know, they lose money, and then I just heard testimony that it's keeping a hospital open. So I'm kind of confused on this statement.
And obviously that is a complex issue. If you'd like to give a very brief response to your specific hospital and its circumstance, Mr. Pennell, you're welcome to. Or if you'd like to pass, and we'll maybe have an opportunity to talk about it more another time, that'd be fine.
Absolutely. I'd love to talk about this in more depth, but I think there's some confusion. Medicare reimburses at a higher rate. So post-acute care, nursing homes with a high Medicare percentage are those that are financially stable and viable. Medicaid does not reimburse our costs. So the Medicaid, highly dependent Medicaid nursing homes, AKA the not-for-profit government hospital districts, small communities, et cetera, that are doing custodial care, those are all at risk because if you replace our facilities with for-profit, post-acute type long-term care facilities, there will be no more margin. And so the subsidies we're already providing will increase, and we will not be able to continue operating those. Happy to go into great detail after this meeting if you'd like more information. Thank you.
Thank you very much. Thank you very much. Mr. Caldwell, anyone else online?
There are 2 more.
2 more. I'm going to ask you to really limit your comments. We are already quite a bit behind, so I apologize. Let's get them both online, and whoever starts speaking first can go. It did, like 10 minutes, 15 minutes ago. Go ahead, please.
Yes, my name is, thank you, Chairman. My name is Nancy Bunot. I'm the administrator of Rocky Mountain Care in Evanston. Just a brief discussion about our facility. We accept Medicare, Medicaid, and private pay. Currently, 75% of our occupants are Medicaid. We run at a current occupancy rate of 75%. We accept those private pay and those Medicare patients in order to remain in business. And so if the certificate of need were repealed, it's very possible for what Mr. Connell has described to happen. Those acute care, post-acute facilities pop up. In the state of Utah, this is exactly what happened. These post-acute facilities started popping up and taking the cream right off the top, putting long-term care facilities that take Medicaid only or primarily Medicaid patients, basically obliterating their ability to make a profit. The staffing is a huge concern. That's been discussed already. The thing that we need to understand is this industry is not a free market system. We are not Burger King or Taco Bell. The government reimbursement and the government payers dictate what we will be paid to take care of a patient. Like it or not, that's the way it is. So who can enter as a patient? The government tells us that, we can only take so many of certain patients. As an operator, I cannot raise rates. If another facility comes into my town, I can't raise rates to cover the cost when 20 of my existing patients go across the street to the shiny new facility. So bringing another facility into a small town, Evanston, I would consider a small town, that could force facilities to close. Definitely, if there are bad actors, get rid of them. We run a 5-star facility with 5-star quality. We have a great reputation in our community. I don't want to compete with others. I want to be the one-stop shop for high quality care in Evanston. So I would ask that we look at the certificate of need, putting in some quality components perhaps, or that we leave it as it is and figure out a way to get rid of the bad actors. Thank you for your time.
Thank you very much. Thank you for being succinct. Questions? See,
Mr. Chairman,
Crum, you better keep moving.
Mr. Chairman, I know we're really short on time. Just one quick question. Is there anything that keeps the facility in Evanston or any facility from upgrading their facility? Well, a new facility would come to town, they would upgrade. Is there anything to keep an existing facility from upgrading to keep those patients from moving to a new facility?
Go ahead, ma'am, if you'd like.
Yes, thank you, Chairman. Thank you, Senator, for the question. As a matter of just information, our facility recently completed an $8 million renovation to remodel resident rooms to allow them to have private showers, remodeling to put in private rooms. We did not increase our bed capacity, but rearrange some things. So absolutely, we here in Evanston definitely want to provide a high quality care and a very nice place for people to be. And we've done that with an $8 million investment as a not-for-profit facility here.
Thank you very much. Mr. Caldwell, who's next?
Good afternoon. Can you hear me?
Please proceed. We can't see you yet, but please proceed.
Thank you. Thank you for allowing me to speak today. My name is Leah Lowe. I'm the Regional Vice President for Empress Healthcare in Wyoming. I currently oversee 6 skilled nursing facilities in our state. That's about 625 beds. As you know, or probably know, 36 skilled nursing homes in our state. And currently the total bed capacity is an average of 67%. And centers are barely making ends meet with the current funding and regulatory requirements. I've worked in this industry for 25 years, and not once have I seen any executive director decline an admission due to the occupancy threshold. Rather, neighboring centers are competitive to who holds the higher occupancy. This bill would further burden the centers with unnecessary expansion costs. There would be price inflation if new beds are added and affect the overall quality of care. One current life example of how a total repeal of the CON would affect us is, as an industry in the state of Wyoming, about 33% of the skilled nursing facilities in our state utilize agency or temporary workers to staff their centers. These staff members are not dedicated to or loyal to the center or the frail people that they care for or the rural communities that they serve. The costs associated with these non-loyal staff have a markup of about 40%. Many centers across the state are taking resources from one area to allocate them to another to offset the costs in the current labor shortage. Again, this is just one example of how the CON bill would create further unnecessary expansion costs, price inflation, and diminish the quality of care. I made it a priority today to testify, as this bill could have a grave effect on the longevity of existing loyal skilled nursing centers in our state. I'm requesting this bill be moved to an interim topic to allow us the opportunity to drive quality and support our state and federal initiatives to provide the best quality care in each of our communities that we serve. Appreciate your time. Any questions?
Thank you very much. Thank you, Leah. Would you restate your name and who you're with? That was a little bit.
Quick,
Please.
I was trying to be quick. It's Leah Lowe, L-O-W-E, and I'm with Empress Healthcare.
Empress Healthcare. Thank you very much, Ms. Lowe.
Thank you.
All right, anyone else online that hasn't heard something that they want to say? Pardon me? Thank you very much. Anyone else in the room? Anyone else in the room? Going once, twice, sold. All right, committee, you have before you certificate of need. Senator Crum, you want to make any closing comments?
No, Mr. Chairman, I just make a motion to approve.
There's a motion on the bill, discussion on the bill.
Mr. Chair.
Senator Scott. Senator
Mr.
Scott.
Chairman, let me say I am very strongly opposed to this bill. I'd be for it if we had a true free market situation, but we don't. We have a quasi-monopoly buyer that is the state of Wyoming, mostly through the state Medicaid program. And that changes things radically. Mr. Chairman, I could hold on at great length, but since you want to get out of here, I'd be happy to reserve my comments for upstairs. But I think this bill is a bill that is likely to cause a vast increase in government expense and possibly would contribute to future tax increases. Not big enough by itself to cause a tax increase, but combined with a couple other things, it is. And Mr. Chairman, I think we'd be much better going to the interim, but it'd take me about 15 minutes to explain why.
Well, we thank you for being brief. Further comments on the bill? Further comments on the bill? There's a motion on the bill.
Thank you, Mr.
Senator Hutchings.
Thank you, Mr. Chairman. I agree with Senator Scott. I've heard this before, and I agree with his sentiments exactly. And it's sad when you hear from the hospitals and you see what kind of damage this could cause. It's a little scary for them. So I too would like to see this in the interim. Thank you.
Thank you. Anyone else?
Really quick, Mr. Chairman.
Yes, Senator Crum.
I think we heard it from the administrator from the far southwest nursing home, who in her testimony said they don't want to have competition. And I think that's what this is all about, that they don't want to have competition, and I don't blame. If I was probably sitting in those shoes, I would be maybe saying the same thing. But when you look at the marketplace, and you look at government protection and creating monopolies, it hasn't worked in any industry environment. It was taken away, the certificate need, from hospitals and our hospitals in the state. I mean, well, some struggle, some are doing fine. We haven't lost healthcare in our state, and we won't lose healthcare with this bill being approved either. Thank you, Mr. Chairman.
Okay, thank you for the discussions. I think I do want to make a comment before we close out this bill. While this may have originated in a particular community, there was several references to maybe both quality of care, but maybe even the motivation of care, meaning good actors and bad actors or characters, et cetera. And I want to be clear that as we consider this bill, that is not what is on the table here. This is a policy matter. Those communities, and through licensing, if there's concerns about the quality of the care, that there are methods to do that. I don't think this committee is taking any position on that, and I want to be clear about that in how we go forward. So I know there was several references to maybe not specific entities, but maybe some would infer that that was about them. And I want to be clear, this committee is not in our actions. I hope none of my colleagues are making doing anything that would be impugning to the reputation of any of those facilities that may be somehow feel that. So with that, further discussion on the bill. Any amendments on the bill? Any amendments on the bill? Seeing none, Mr. Caldwell, will you call the roll on Senate File 89? Oh, actually, I'm going to make a comment. And this is my own perspective. I guess I've heard this issue several times. I am frustrated that we don't have a better, and I'm actually tired of the excuse we need to go to the interim. If the industry wants to have this discussion, the industry should have this discussion and bring us the solutions instead of relying on the legislature to bring you to the table. And that's a personal frustration of mine, having heard this bill 3 or 4 times, or this issue 3 or 4 times. So that's my first, and I apologize. Maybe I should have planned my comment a little more, to be a little less pointed. The second thing I would say is, I also have a frustration the way this is being implemented, because when I look at the definition of nursing care facility, and I said this the last time this bill came before us, it includes assisted living facilities in the definition in this title. And so if we're going to talk about this, I think we should be actually looking at assisted nursing facilities as well, just by the plain reading of the statute. And we are not doing that. So I have two frustrations. One is, if there's going to be a conversation, you shouldn't have to rely on the legislature. If you believe there's something to be done, please bring it to us, bring us solutions, have your own working group. That's one way. The second is, and I've said this before to the agency, and I've had this conversation with this good senator, and he has his reasons for what it didn't, assisted living didn't exist when this came into it. And that may be, but that doesn't mean that the law shouldn't actually mean what the law is, in my view. So, thank you. Mr. Chairman, or Mr. Former Chairman, go ahead.
Chairman, I would say one thing, they have brought to us a significant solution to the problems, and that is increased Medicaid spending on reimbursement.
Fair enough.
And frankly, that's the major obstacle we've got right now.
Thank you. I appreciate that. I appreciate it from the former chairman. All right, Clayton, if you will call the roll on 89, again, to my committee members, I apologize for the long hearing.
This is a roll call vote for Senate File 89. Senator Crum?
Aye.
Senator Hutchings?
No.
Senator Scott?
No.
Senator Steinmetz?
Aye.
Chairman Barlow?
No.
Mr. Chairman, that is 2 aye and 3 no.
Thank you very much. The bill will stay, will not go to the floor, will not be reported out. I can tell you, that vote was a 50-50 for me as the chairman, as you know. There's more to be learned. It would have taken a long time on the floor, but I hope my request, my frustration was clear to those that are interested in this topic, that you actually do something about it. So thank you. We are adjourned. So the committee, we have 2 bills on Friday, 2 bills on Monday, and 1 bill on Wednesday. They're already in the queue. And then we'll have, I believe, 2 bills on the next Friday. Thank you.
Thank you, Mr. Chairman.
Thank you.